what tasks would you say require doctors to prioritize seeking concrete data? So this is getting at the cognitive function of extrovert sensing. It's basically looking outside of yourself and seeing what concrete data is out there. What do I need to address? Something tangible, concrete data, basically. So what are some tasks that you've experienced that require you to prioritize this seeking concrete data?
I mean, I think everything that has to do with staying up to date in medicine and tailoring your practice to the newest findings has to do with the newest research. So you're basically in constant pursuit of journal articles and different studies that are published that should be kind of directing your practice, whether that's like new medications on the horizon, new guidelines for different conditions and how to treat them, both medically and outside of medicine in a more holistic approach. So yeah, I think just like staying up to date on treatments and different innovations in the field, that's all based on concrete data and should be based on the scientific method.
Introvert sensing, which is basically seeking knowing concrete data that you've internally stored. So while, what we just talked about, extrovert sensing, that was about looking outside to, for new concrete data and concrete tasks around you. Introvert sensing is about already knowing concrete data, going back to what you've stored in memory about, what's known to work and whatnot. So what are some tasks that require you to basically rely on memory a lot, basically, going back to what you know about concrete data?
Well, in dermatology, I mean, it's a mostly clinic-based practice. So you just see a lot of patients, maybe, more than 20 and a half days sometimes. And I think basically every single patient you see, you're having to tap into what you've learned throughout medical school to first identify what condition they have, and then B, figure out what you're going to do about it. So I think you're constantly tapping into that reservoir just a million times a day, trying to figure out what you're going to do with your patients.
Yeah. You would probably agree that some specialties, though, probably use it a lot more often than other specialties that are more, I guess, like, for example, psychiatry. Yes, you do have to have memory of, all the different criteria to actually diagnose someone, but it does require a lot more, I guess, intuitiveness than compared to like other specialties, I guess. So
yeah, and surgery too, you could argue muscle memory and not as much like tapping into a cognitive reservoir, or maybe like a more concrete knowledge kind of thing. So yeah, no, definitely. I think derm, there are procedures, and so those procedures are very small and they're not as frequent as a surgeon's day would go, but it's a lot more of the cognitive load that you see. So I think there's a lot of just constantly, I think back to medical school and the things I learned constantly with my patients.
Well, that's good. I usually hear the opposite for most doctors. Like, I use nothing that I learned in medical school in my practice.
I will say not a lot of step one material, but I do post step one. I felt like step two, a lot of the medications and their side effects, because we do have kind of a large medications we prescribe. Everyone thinks just steroids, and steroids are important, but there are a lot of like biologics, vitamin analogs, a lot of immunotherapies that we use that I think I learned about in medical school, and I tap into that a lot.
That's good. Yeah. Yeah, I mean, surgery and actually doing procedures, that's a good example of using extrovert sensing, because you're focusing on the external and the concrete and the external. Whereas introvert sensing, like we said, it's more about going inwards and looking for concrete data inwards, what you already know, what you've already stored.